Here, which means pumpkin spice everything and fall activities like apple picking. But apples aren't the only thing that need picking around this time. It's also time to pick health insurance and for our upcoming year. And Medicare's annual enrollment period kicks off today until December 7th. This is an opportunity for those 62 million people who are enrolled in Medicare to make any changes for the next year. We're joined today by Regional CEO of United Healthcare Medicare and Retirement. She's going to give us some tips and tricks when making our coverage pickings. Elena, to start off, can you tell us why seniors' decisions are so important during the annual enrollment period, not only for their health, but for their wallet?
Absolutely. This 54-day period is crucial because every person's needs are unique, and the decisions that you make between now and December 7th will affect the healthcare decisions you make next year and your out-of-pocket costs. So really, your entire well-being, and we ask that you spend a lot of time exploring your options and thinking about how your health may have changed over the last year.
So I have another question for you. It's so important, especially the annual enrollment. Can you tell us why people dread it?
Well, we've surveyed Medicare beneficiaries and found that 40% of them do indeed find the Medicare program confusing. And this is even more acute at this time of year because their mailboxes are full of mail from their current plan and then all these other plans that would like for them to join and become members. So this is our opportunity right now to help people get past the confusion and get to some peace of mind about how to go about making the right decisions for themselves.
Definitely. Now, what's the first mistake you commonly see people make during annual enrollment?
Well, the first mistake we see people make during annual enrollment is just to sit out entirely and just let their health plan coverage roll from year to year. We actually ask that people not do that. Your health may have changed and may be different now than it was a year ago. There could be a change in your plan itself about out-of-pocket costs or whether your doctor or hospital is in network. So we ask that people take this important time to review the materials that their plan has sent to them and then compare that to their other options in their communities.
So now we know that you definitely need to take action during annual enrollment. How about mistake number 2?
Mistake number 2 is when people decide to make their health coverage decision based purely on comparing premiums and going with the lowest premium possible. It's important that people look beyond the premium and look at out-of-pocket costs like deductibles and copays, and then look even further beyond that to other benefits that may be available under a plan. Some Medicare Advantage plans offer gym memberships at no additional cost. They offer vision coverage. Some of them offer drug coverage, and yet others will offer low-cost hearing aids. And that's important because when you go out in the open market to purchase a hearing aid, you can spend $4,000 or $5,000 per hearing aid, but you can get them at a significant discount with some Medicare Advantage plans. So look at the whole picture. Please don't just stop at the premium.
That's great advice. Now, a topic like this, again, is so important, and I'm sure folks will want to spend more time doing their own research. Can you share some resources that can help people with their Medicare enrollment decisions?
Absolutely. I recommend UHC MedicareHealthPlans.com. Also, another website to consider is MedicareMadeClear.com. But please do take the time to speak with a licensed agent and to look at some of these resources I've shared with you today to make sure that you spend time looking at what your unique needs are and compare that to what's available.
We'd like to thank United Healthcare for sponsoring that segment. For more information, visit UHCMedicareHealthPlans.com or give them a call at 1-800-UHC, which is 6509.